Everyone, and welcome to the Mouthy Matters podcast. Today, I have Dr. Claudia Eisenhuth and Peter Eisenhuth, and we are going to be talking all about Perio toothpaste, specifically Super Paste Perio formulation. Dr. Claudia and Peter, thank you so much for being here.
Thanks for having us.
Thank you.
Yes. So, Dr. Claudia, can you tell me about the Perio line of toothpaste? Because Dr. Jen Oral Care Products has all kinds of other great toothpaste products and wonderful floss that I got to talk to Dr. Jen about. But this new formulation, I'm super excited about since my wheelhouse is all about bleeding gums and periodontal disease. But would you share with us just how this product came about?
Yes, of course. So gum health is incredibly important systemically as well. And that's something that I've noticed has been trending online is the importance of just flossing every day. The importance of your gum health can have systemic impact on the rest of your body. And personally, I had a health struggle when I was overprescribed antibiotics at age 22 and hospitalized with C. diff. And at such a young age, this was a potentially deadly infection. It was very scary. And I started to learn about not only the impact that each ingredient that you are either exposed to or each ingredient that you consume has on your entire body, but how sensitive our system is to something that can disrupt it. So something I learned with my doctors is that there are a certain level of toxins that you might be exposed to, but if you can limit your exposure to toxins wherever you can. And so a really big one is toothpaste. And so because we are putting it in our mouth, we're swallowing a percentage of every time that we brush. And so through being sick myself and having this journey, I had to be very careful with which toothpaste I was using and make sure it was sensitive to the microbiome. And this is true for everybody. That was the other big thing I learned in the health journey is a lot of people can be experiencing a side effect to an ingredient that is toxic and not be aware of it. And so our gums, sometimes it might not be until you go to your dentist that your dentist might say, okay, your gums are starting to look a little red. And in dental school, we were taught that look at their toothpaste. So it could be sodium lauryl sulfate, it could be propylene glycol. There's a number of other ingredients that are used that are inflammatory, and they can cause what can appear to be, sometimes it could appear to be a bacterial or another cause or viral, but it's actually a reaction to an ingredient that their body is not responding very well to. And so I think there's a lot of people out there that are using toothpaste that they don't know their body is sensitive to, and it's causing a disruption in their oral microbiome. And so that's why, and so more specifically to perio disease is incredibly challenging. It's painful, and so that's something that for us it was something that we had people asking, and we had a lot of people with periodontal disease using the original Dr. Jen formula and coming to us and saying that they were experiencing these amazing benefits, and they can now eat warm foods or cold foods, and they couldn't before. And so that's where my mom, Dr. Jen, really started to dig into what else can we do for these patients. And Dad, I think you can get a little bit more into the specific ingredients on the Perio paste.
Yeah, I would love to hear what's in it and what's not in it. Those are both sound like they're really important. When I was talking to Dr. Jen, she was mentioning how, so many of the formulations that we see on the shelves are from the 1970s, and they really haven't changed, even though, I wouldn't want to see a physician that stopped learning in the 1970s, let alone use a product that had science from the 1970s, because we know more, so we want to do better. So yeah, I would love to hear more about the ingredients and why you chose them.
Yeah, Tosha, I can expand on that. And Claudia, great intro to why we're here. Regarding toothpaste formulations, what we can assume is if you are a manufacturer that is really driven to have high profit margins, you're going to want to source ingredients that are less expensive. So there are petroleum-derived ingredients, and there are ingredients from the 80s. Really, we could talk about sodium lauryl sulfate. We could talk about potassium nitrate. There are ingredients, and really ingredients, whether it was the 60s through the 80s, that were introduced into toothpaste. For manufacturers to replace some of these ingredients with ingredients that can actively manage hypersensitivity, like nanohydroxyapatite, it's going to make the toothpaste more expensive. A high-grade, high-quality, high-concentration nanohydroxyapatite toothpaste, at least from a manufacturing perspective, it would be quadruple the price of a traditional formulation. And so you can see why certain brands are not quick to increase the expense of their manufacturing costs, yet in countries like Japan and Europe, they have. And so we're just playing catch up here in the US. So let's get into some ingredients that can contribute to periodontal disease. One is sodium lauryl sulfate. And this is an ingredient that shouldn't be in toothpaste. Why was it put in toothpaste? It was marketing. It was purely a marketing ploy in the 60s. When toothpaste first came out, manufacturers were racing for market share. And one of the Don Drapers out there, a character from the Mad Marketing series, said, well, gosh, let's put foaming into toothpaste because consumers associate foaming or bubbles with cleanliness. Well, if we look at sodium lauryl sulfate, it does that. It creates foam, but its main function is to reduce surface tension. So it's great for breaking down oil and grease in our pots and pans, but our enamel does not accumulate oil or grease. So we don't need sodium lauryl sulfate. It's put in for solely marketing purposes. But if we read the studies and we know more about how damaging sodium lauryl sulfate is, it causes mucosal dehydration, microbiome imbalance, periodontal destruction. It does a lot of harm. And then to Claudia's point, why Claudia couldn't use traditional toothpaste, it's really hard on our gut bacteria. So for any of you listening, if you have any type of periodontal disease, and you're currently using a toothpaste that has SLS in it, if you could switch to a foamless toothpaste, you should notice some improvements because that isn't an irritant. Not only does it irritate our soft tissues, it's attributed to mouth ulcers. And so in the Perio paste that Dr. Jen has, there is absolutely no foaming. The other issue that a lot of our patients have that have periodontal disease is they have sensitivity issues. Why? Well, when we have gum recession, we have exposed dentin. Dentin is just what's underneath our enamel. And yes, when we're eating sugars, sweets, hot and cold, what's happening is it's exposing these ingredients to the nerves of our teeth. And so what came out in the 80s as a solution to help patients manage hypersensitivity is potassium nitrate. Now, back to what's good for your body, what's biocompatible. Potassium nitrate is the same ingredient in explosives, rocket fuel, and fertilizer. In fact, some of these products that have toothpaste in it that incorporate potassium nitrate, they have warning labels on the back that says if you use this product for more than 4 weeks, see your dentist because you could have other underlying health issues. But what potassium nitrate does is it serves as a pain block. The potassium ions in the potassium nitrate null the pain signal between the nerve of the tooth to the brain, doing nothing to address the underlying problem, leaving our dentin exposed to acid challenge. Nanohydroxyapatite, however, it's classified as biocompatible, meaning it's something that our enamel is composed of. 97% of our enamel is hydroxyapatite, 70% of our dentin. It's also classified as biomimetic, meaning our body produces it. But most importantly, regarding the health, it's something that we can swallow safely. The crystals simply dissolve. There's studies where they've coated nanohydroxyapatite on oral mucosa and found that no penetration in the epithelium. So there's numerous safety studies on switching from potassium nitrate to a nanohydroxyapatite, but how it functions regarding the exposed dentin is different than potassium nitrate. As we said, potassium nitrate's a pain block. Potassium nitrate, instead of addressing the symptoms, it goes after the underlying problem by occluding the dentin tubules, coating the dentin. So when we get into these low pH cycling events, hot and cold, those areas are protected. And there's really two takeaways here with switching from a potassium nitrate to a high-quality nanohydroxyapatite product is, number one, we're going to have better pain management. There's studies showing that nanohydroxyapatite, if it's made properly, is more effective than potassium nitrate. The second is something we refer to as root caries. Dentin is very soft. We know our enamel is hard, but when we go through these acid challenges, what's happening, the enamel gets softer and can start to dissolve. Well, the dentin does the same thing, but it breaks down faster. And so if we can coat these areas with nanohydroxyapatite before these acid challenges, we can reduce something called root caries. What happens is, and I'm one of those, I'm getting older, I have a crown and I have a little gum recession where my dentin is exposed and I've always had sensitivity. Well, those areas over time can start to dissolve or the dentin start to dissolve. We call it demineralization. And if you're a geriatric patient, you have crowns or even bridges, the foundation can become unstable over time if those areas are not protected. So there are clinical trials and studies showing that nanohydroxyapatite not only will help manage the hypersensitivity, but it will help reduce what we call root caries or preserve the dentin. And then lastly, regarding the toothpaste, Tosha, and you kind of hinted on it, sometimes it's not what you put in the toothpaste, it's what you take out. So we did remove the sodium lauryl sulfate, we removed the potassium nitrate, but we also lowered the abrasivity. We want very gentle abrasives in our toothpaste to help remove plaque and maybe some food stains. But if it's too abrasive, it can harm the enamel, the gums, and as we said earlier, the dentin is very soft. So most of our product lines, the abrasivity is around a 60, which is still considered low. But what Dr. Jen did was she lowered this even lower to a 33. So it's fairly low on the abrasivity. And then she did add in some healing botanicals, both calendula and aloe vera, which are proven to help reduce oral tissue inflammation. We also have xylitol in there, which is great. When we look at patients that have deep pockets, well, it's a great place to collect bacteria, whether it's P. gingivalis bacteria, Streptococcus mutans bacteria. And so the nanohydroxyapatite crystals not only are going to coat and protect the enamel, they will cling to P. gingivalis bacteria, helping removing the bacteria, which is wonderful. The xylitol also has that benefit as well. As we know, bacteria like Streptococcus mutans feeds on the xylitol, but it cannot process it, and so it dies off. So we have some bacteria reduction ingredients that are not harmful. They're not caustic. We have some healing botanicals. Regarding the birth of this toothpaste, we didn't mention it earlier. The product line was really birthed helping our daughter Claudia, but the Perio paste was a product Dr. Jen created for her mother. Her mother has been working with a periodontist for over a decade. Her mother was on high prescription fluoride toothpaste that actually had SLS in it. Well, Dr. Jen looked into her mother's mouth a little over a year ago and said, "Mom, we can do better." So she started working on this formulation, and that's how it came to light. The fun part is the testimonials we get. Dr. Jen's periodontist, her mother's periodontist contacted Dr. Jen just last December asking what she did differently for her mother. Dr. Jen said, "I didn't glove up. I didn't work in my mother's mouth. However, I made this toothpaste for her." Well, the periodontist reported that not only did she have less pocket depth and healthier gum tissue, but now for the first time, she actually sits comfortably through her cleanings. Most patients that have any advanced periodontal disease, they're generally going in every 3 months and they're going through these deep cleanings, and they can be really uncomfortable. And even with Dr. Jen's mother, she would start to complain about having to see her periodontist a week and a half, 2 weeks before her appointment. Now she can actually sit comfortably through her cleanings without any discomfort because of the high concentrations of nanohydroxyapatite being able to occlude these dentin tubules, coat these areas, so she has little to no sensitivity during her cleanings.
I love that so much. One thing that I wonder, and maybe you guys can answer this for me, is I feel like I've had patients that when they've tried to get off specific sensitivity controlling toothpaste, I won't name names, but they have that potassium nitrate in them. They go through, if they don't have something to substitute it, like your guys' toothpaste, but they notice an increase severely in their sensitivity. And so they can be very habit forming. And so they have, not only the SLS in there that's foaming, that's scratching the surface up essentially, and then they're kind of band-aiding it. These are my really technical terms here with the potassium nitrate, but we're not ever fixing the problem. I mean, a lot of those have some fluoride in there, but there's just so many other chemical interactions. And so what I'm thinking about is fluoride works well with saliva. And so if we're having a patient that has periodontal disease, for example, a lot of times their mouth is not really moist because periodontal disease changes the pH. It changes everything. Like people's saliva gets very thick and ropey, even if they don't notice it. A lot of times as hygienists, we notice that everything just feels a little different. So can you speak to these combinations that, if somebody's trying to, if they're going like, okay, so I'm just using like an over-the-counter toothpaste that I would get at Walmart or Walgreens. It probably then has these two ingredients in it that probably aren't helping my body in general. If I get off of it, should I expect a little bit more sensitivity temporarily if I'm switching to like a Dr. Jen's super paste or one of your other toothpastes?
Yeah, well, Tosha, if you look at the studies on hypersensitivity management with nanohydroxyapatite in particular, the longer you're on the product, the less sensitivity you'll have. You're right. If your patients are on a nerve blocker or pain blocking ingredient, it's really going to cancel pain signals. If we take them off of that for the first time, their nerve signals are going to be doing what they're supposed to be doing. But think of our body. Why does the body have pain signals? It's usually damage is occurring. And so that's not necessarily a bad thing to allow these nerves to do their jobs. Now, will there be a transition? I think it depends upon how severe their sensitivity is. The fun part about nanohydroxyapatite, and maybe you've seen this in your clinic, We hear from hygienists that patients will sit down that typically need like benzocaine or a topical just to do their cleanings. Well, they're actually applying our toothpaste chairside on their patients, and they immediately have sensitivity relief. So overall, overwhelmingly, from patients that have had a lot of sensitivity on using a potassium nitrate as their product to mask that. After they've switched to nanohydroxyapatite, they generally don't have issues. But occasionally we'll hear a story or two where somebody will use our product. They'll switch from, say, a potassium nitrate product to Dr. Jen's products with the high concentration, high quality nanohydroxyapatite, experiencing hypersensitivity that they didn't experience before. I just had a conversation with a dental provider a few months ago. They said, well, gosh, I switched to Dr. Jen's and I noticed some sensitivity after switching. And I asked them what their protocol was. And they said, well, when I wake up in the morning, I grab my toothbrush, my Dr. Jen's toothpaste, I brush with it, and then I grab my water pick and I go into the shower. So for nanohydroxyapatite to really do its job, we have to follow the American Dental Association guidelines with fluoride. These crystals do take time to form a chemical bond. So the takeaway there, if it's used properly, your patients should experience less sensitivity. So what is properly? We brush twice a day, spit, do not rinse, and wait 30 minutes before consuming food and beverage. Back to the story of the dental provider, we talked about, let's switch this up. Let's have you use your water pick first and then brush last. I followed up, and sure enough, they said, yeah, that works so much better. So anytime we rinse or we're consuming foods and beverages after using an oral care product, it's like throwing the baby out with the bathwater. But if the product, once again, if it's used properly, they should, for the most part, they should notice less sensitivity. That being said, studies show the longer you're using nanohydroxyapatite, the less sensitivity you will have.
Whenever I have patients that have sensitivity, we go through what my dad just talked about, just the basics that we're taught in dental school. What are you doing right after you brush? And every time I've asked, all of my patients say, oh, well, I rinse. And they act like it's the craziest thing in the world. So I actually, with one patient, she just sat there, she's like, that's not true. And she was maybe 60 years old. And she's like, my whole life, I always rinse after I brush. And so I brought up the ADA's recommendation: every time you brush, don't rinse, so that whatever it is you're brushing with, let it sit on your mouth and, work. And so my patients are always surprised. So that's definitely a really big thing that we talked about. And also, what you both were talking about too, whenever we talk about health, it's super important that we're looking for a cure and not a Band-Aid. And so I think you used the word Band-Aid, and that's something that's been a really big shift in just healthcare in general. And when we start to look at for an actual cure, and potassium nitrate is an excellent Band-Aid when we just attack the nerve right there and let it sit on there. But like my dad was saying, there's reasons why there's warnings on that. It is important, if there is something going on, that we address it. And if someone is experiencing sensitivity, and if nanohydroxyapatite can help with it, with the actual cure of that, and help with it from that level versus just putting a Band-Aid on it, that's been amazing for patients. And so I do think, I think even if there's a little bit of a transition there when they're not using this potassium nitrate, we've seen incredible results where when they've been using nanohydroxyapatite and letting it sit. And we also we've seen incredible results where people are saying, okay, now I can finally eat cold foods. And then I was going to say, we've also had a lot of patients where they'll put a little, like, let's say they have a little gum recession in one area. After they finish brushing, they can put the toothpaste on their finger and let it sit there overnight. And that's been really helpful too, if there's a specific spot that's bothering somebody.
I do that myself. I have more recession than I'd like to admit. Years of clenching my teeth. And if ever I have like a night where apparently I was stressed and didn't sleep very well, I'll just gob that toothpaste on before I go to bed. Yeah. And the next day, it's like I don't even remember that I did it, but it all feels so great. I think when it comes to swishing, like I think about, before I used toothpaste that was healthier for me, I used just the regular foaming stuff, and I can't even imagine letting that sit on my teeth. Like there's so many gritty ingredients in there, and other just like your mouth just feels a little gritty with a lot of traditional toothpaste. And so rinsing afterwards is just to get all that extra out. And there's so much extra flavor in traditional over-the-counter toothpaste. I did that with my family, that I've had as many of them as I can get to switch to you all, which is, I think, all of them now. To the Dr. Jen's, they're all like, it's so mild. And I'm like, yeah, that is really how it should be. You don't need all that extra stuff in your toothpaste. And so if you brush and then your mouth is just like you breathe and all you breathe is menthol, do you need it all? Like, is it good for you? So yeah, it makes sense that people want to swish, like with the traditional toothpaste.
No, that's such a good point. When you can taste the chemicals, and that's something that people have said to us when they switch to Dr. Jen's, and then let's say they're traveling and in their to-go bag they have what they used to use, and then they say, okay, I just taste chemicals now. And so, no, you're right. If your body, you're right, you might have a natural inclination to want to spit it out if you're using something a little more chemically tasting. But with Dr. Jen's, it's that fresh peppermint oil. It definitely, you don't mind letting it sit on there.
Yep. One of my brothers had a lot of trouble with toothpaste for a long time, and he just hated to brush his teeth because every time he brushed his teeth, no matter what brand he used, just his gums felt really irritated. And whenever I would clean his teeth, his gums looked really irritated, but he didn't have gum disease or anything like that. And so eventually, finally, I mean, we're all adults now, so I don't really get to clean his teeth very often, but I sent him, I think for Christmas, I gave him like a couple tubes of your guys' eggshell. He messaged me back and he said, my mouth has never felt so good. He said, my teeth feel clean. I actually look forward to brushing and I used to dread it. I mean, this is a 30-year-old dude. It was life-changing for him. So, I mean, we don't really know what we're having an allergy to. And with so many ingredients in most products that we use just in general in life, it's really hard to know, like, what is my body not liking in this? And so I love that your guys' product is so clean, only has what you need, not a bunch of extra.
No, that's such a good point. And that story is so cute. And that's why we do this, is stories like that. And I've had, even like, speaking of not understanding the reaction, I had I know a couple people in dentistry as well that were getting external reactions to toxic ingredients where they were starting to get a rash around the area. And when they get rid of that ingredient, the cellulose sulfate and petroleum glycol or propylene glycol, it's just like so much better.
I love that. So speaking of the products, I know you mentioned them very briefly, Peter, of what you guys are using in the Perio blend of the toothpaste. Would you go over that just one more time and how the specific ingredients that you guys chose? So aside from the hydroxyapatite and all the benefits of that, but you mentioned aloe and a couple others. But would you go over those one more time for me, just so I know, like, what are these ingredients and why do I want them if I have bleeding gums?
Very, very good. So back to the Perio paste here. We have two versions of it. We have a fluoride-free version that we're releasing that should be out fairly soon. And then we have one that does combine fluoride with nanohydroxyapatite for those that are higher risk for caries. But regarding the actual gum health, the nanohydroxyapatite at high concentration, once again, is going to not only strengthen the enamel, it's very effective at reducing bacteria attributed to periodontal disease, P. gingivalis, Streptococcus mutans. And then, as we mentioned, the nanohydroxyapatite is going to help manage hypersensitivity while preserving the dentin. The calendula and aloe vera are added botanicals that do help reduce inflammation, oral tissue inflammation. We also have vitamin K2, D3 in there. Let's see, what am I missing? And then the xylitol. The xylitol does a number of things. It's going to help raise our pH. It stimulates saliva flow, which is wonderful. We love saliva. And then xylitol can also help reduce some of the carcinogenic bacteria. Claudia mentioned essential oils. Peppermint and spearmint oil can reduce oral pathogens, reduce gingivitis bacteria, and also stimulate saliva flow. In summary, Dr. Jen put a lot of time into this formulation to help her mother. And we're grateful now that the formulation that she made for her mother is now available for other patients suffering with advanced periodontal disease.
I love that. I would imagine the aloe is very soothing.
It is. I don't have periodontal disease, but I brushed with the toothpaste a week ago, and it's like, wow, it's just so smooth and calming on your soft tissues. You can brush, and that's the other thing. If you don't have periodontal disease, you can brush with it. It obviously is designed to help folks that have gum disease, but it is, it's a very smooth toothpaste.
I love that. This has been so fun and so incredibly informative. Is there any last thoughts that you guys want my listeners to know about when it comes to any of your products?
Well, I think the biggest thing, Tosha, is that we are a dental family, especially when we look at fluoride-free products. The FDA has very little regulatory oversight. What we're seeing on Amazon today, it's really a bunch of venture capitalists that are monopolizing the space. As great as they are at marketing, they generally don't make their toothpaste. It's a private label formulation. Why we're here today as a dental family is because when Claudia was ill and Dr. Jen did the research on nanohydroxyapatite, in particular fluoride-free products, came up empty-handed. She decided to really invest a lot of our personal savings. Over the last 7 years now, we have more patent and patent pending formulations than any other brand. And we do pride ourselves in putting patients' outcomes ahead of profits. And we're grateful for any of your listeners if they try our products, and not to sound silly, but if they do buy our products and they're not happy with them, we actually have a 30-day smile guarantee. They're welcome to call us and we'll refund them. Good luck getting that from some of the big pharma brands, but that's how confident we are with our products. We also understand, Tosha, that everybody's oral microbiome is different. So what's good for one patient isn't necessarily good for the other. We're all unique. And we do believe our Perio paste is just a great tool for anybody suffering with periodontal disease.
I love that. I love that. I love all your products. I tell everyone about it. I mean, I so value that you guys are so science first, and it can be very difficult to know where products are sourcing their ingredients from, why they put them in there in the first place. Just all those nitty-gritty details get kind of lost on our toothpaste that shouldn't be a beauty product. It should be a health product. And so it gets really tricky. And so I value that so much about Dr. Jen's oral care.
Thank you.
Well, thank you guys so much for your time. I will definitely link to Dr. Jen's oral care in our show notes if you guys want to get yourself a tube or 10 like I do. You'll love it so much. You'll send it to your family. And thank you guys so much. Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.